Okay, let's talk about overtraining. It's something that can affect any athlete, whether you're just starting out or you're a seasoned pro. It's what happens when you push your body too hard without giving it enough time to recover. Your performance starts to suffer, and you might experience a whole bunch of physical and emotional symptoms. We're going to dive into the details of overtraining, and we'll be using some insights from the book Lore of Running. What exactly is overtraining? Overtraining is pretty common, but it's often misunderstood. It's not just about feeling a little tired. It's a chronic stress situation where your body just can't keep up with the demands you're putting on it. A lot of times it starts with the desire to improve. You get that initial excitement from racing. You see your potential, and naturally you want to train harder. But that can be a trap. There's this idea that more is better, and that can lead athletes to train harder and harder, ignoring what their body is telling them about needing rest. How do you know if you're overtraining? The signs can be really different from person to person, and they affect both your body and your mind. Emotional and behavioral changes. Overtraining can really mess with your emotions and behavior. You might start losing your enthusiasm and drive, feeling a general lack of interest in your sport, and just not enjoying things as much. You might not even want to compete anymore, and some athletes even feel like quitting during events. You might also feel constantly tired, lethargic, and just generally worn out. People might describe you as peevish, irritable, miserable, anxious, or depressed. It can be hard to relax, and you might feel bored a lot. It can even affect your concentration at work or school, and you might have trouble sleeping, like insomnia. Even when you do sleep, you might not feel refreshed. Other signs include losing your appetite, decreased libido, poor coordination, increased thirst, and needing to drink a lot of fluids at night. Physical changes. There are a lot of physical signs too. One of the biggest is that your physical performance will be impaired. You might not be able to complete your usual training sessions. You might gradually lose weight and start to look drawn with sunken eyes. Changes in your heart rate are really important to watch for. This could include an increase in your early morning heart rate by more than 5 beats per minute, an abnormal rise in heart rate when you stand up or during or after a standard workout, and a slower recovery in your heart rate after you've been exercising. You might also have heavy legs, feel sluggish for more than 24 hours after a workout, have muscle and joint pains, and persistent muscle soreness that gets worse over time. You could also experience swelling of your lymph nodes and gastrointestinal issues like diarrhea. Overtraining can also weaken your immune system, so you might find yourself getting sick more often, having more allergies or headaches, and even small injuries take forever to heal. Women might stop menstruating, amenorrhea, and there might be changes in blood tests too. The history of understanding overtraining. This isn't a new thing. Back in 1923, a guy named R.T. Mackenzie talked about different kinds of exhaustion after exercise. He described staleness, which is basically a long-term fatigue that can take weeks or even months to recover from. Later on in 1971, Heiss pointed out that getting sick easily is a big part of overtraining. And then Tom Osler in 1967 put it all together in a way that runners could really understand. Why do athletes overtrain? It often comes down to not really knowing our limits. We tend to think that if we just push harder and harder, we'll automatically get better. And when we don't perform well, we make the mistake of thinking we need to train even more. It's a vicious cycle. Also, overtraining can happen after long periods of super intense training, or when you do a bunch of races really close together, especially after those intense training periods. How to avoid overtraining. The key is to understand the different stages of overtraining, and to know the difference between normal training fatigue and the kind of extreme fatigue that means you're overdoing it. A swim coach named James Councilman had some great insights on this. He basically said that feeling tired is normal as long as your performance is still good. But when you start seeing your performance drop in practice, that's a red flag. Councilman also believed that athletes shouldn't fully recover before their next workout. He felt it was better to keep them in what he called the valley of fatigue. He even had a diagram to show how fatigue levels change during the week. The very first sign that you're heading into overtraining is that your performance starts to decline. If you're not carefully tracking your training, you might miss this. That's why it's super important to keep detailed records of your training. A runner named Bruce Fordyce is a great example of someone who tracked his training meticulously. By comparing his workouts over the years, he knew exactly where he stood. Time trials can also be helpful for monitoring fatigue. It's not just about the time on the clock, but also how much effort it took and how quickly you recover afterward. If you're improving, you're good. But if you have to work harder to get the same time, you're overtraining. If you miss these early signs, you might develop what Fordyce called the plods. The plods are like a milder form of overtraining with symptoms like muscle soreness, fatigue, and diarrhea. The good news is that the plods usually go away pretty quickly with rest. After resting, you should feel great on your next run, with no soreness and even running faster than usual. Grete Weitz called the plods a mini burnout. It's normal to have some muscle stiffness at the beginning of a run, but it should go away as you warm up. If the soreness sticks around or gets worse, stop the run and rest for a couple of days. If you still don't feel strong after that rest, you've got the super plods and need even more rest. Ignoring the super plods can lead to full-blown overtraining with all those nasty symptoms we talked about earlier. The most common symptoms are muscle soreness, lack of motivation, increased resting heart rate, and sleep problems. Recovery from this can take a long time. We're talking weeks. Weitz calls this a maxi burnout. Other things that can lead to overtraining. It's not just about training too much. Other factors can make you more likely to overtrain, such as poor nutrition, drug use, not enough sleep and rest, bad weather, an irregular lifestyle, work stress, emotional conflicts, monotonous training, and everyday stress. Remember, training affects your whole life, and these things can all play a role. Spotting the early signs. It's super important to catch those early signs of overtraining, like the plods and superplods. Often it's easier for someone else, like a coach, to see these signs than it is for you to see them in yourself. The human body is incredibly adaptable, but it's not designed for extreme long-term stress. So even though we can push ourselves, there are limits. It's not just in your head. When you're overtrained, your body is the first thing to give out, not your mind. You might feel mentally ready to go, but your body just won't cooperate. What's happening in your muscles? You know how you get those super tired feelings after a long run or a period of heavy training? I used to think that was just from using up all your stored carbs, but that doesn't explain why it takes so long to recover or why you can't run marathons close together. It seems like there's more going on with your muscles and other parts of your body that need time to heal. Studies show that tough workouts like marathons or heavy daily training actually cause muscle damage, and it takes a long time for those muscles to recover. For example, researchers looked at muscle tissue from marathon runners and found signs of damage that were worse a few days after the race, but still there even a week later. And get this, some runners had muscle damage before the race, which means the training itself was causing damage. Other studies use special techniques to see damaged cells in ultramarathon runners, and they found that the runners with the most muscle soreness had the most damage. This suggests that if you're really sore after a race, it's going to take longer to recover. Scientists have also taken a close look at muscle tissue after marathons and seen different kinds of damage to the parts of the muscle cells. This damage seems to happen in areas of the muscle that are low on energy. And while it's not usually severe, it can take a long time to repair, like up to 10 or 12 weeks. And it's not just marathon runners. Research on other athletes has shown similar things. That intense training leads to muscle damage. So that muscle weakness and soreness you feel when you're overtrained, it's probably a sign of real, ongoing muscle damage. Now, there's another kind of muscle soreness that might be from damage to the connective tissue in your muscles, not the muscle cells themselves. So how do you know when you're doing too much? Well, it seems like races up to about 21 kilometers don't usually cause a lot of muscle damage. But longer races like marathons definitely do. Muscle fatigue from daily training. It's not just big events that cause muscle fatigue. Even training every day can lead to it. Studies on swimmers have shown that their muscle power is actually lowest when they're training the most, and it increases when they reduce their training before a competition. This is why tapering or reducing training before a big event is so important. Psychological side of overtraining. Overtraining doesn't just affect your body, it affects your mind too. Researchers have found that intense training can lead to mood problems like feeling less energetic and more tired, depressed and angry. The good news is that these usually get better with rest. Some experts think that keeping an eye on your mood could help you avoid overtraining. Overtraining, a whole body issue. To really understand overtraining, it helps to look at the bigger picture. A scientist named Hans Selye studied how animals respond to stress, and his work gives us a good model. Selye found that when animals are stressed, they initially have a reduced ability to resist that stress. If they survive, they enter a phase where they're better at resisting that specific stress, but worse at resisting other things. Eventually, if the stress continues, they run out of energy and become exhausted. It's possible that overtrained runners are in this exhaustion phase, which would explain why they're more likely to get sick or have other issues. There's even a theory that severe overtraining could be related to a condition called Addison's disease, which involves problems with hormone production. Researchers have studied this and found that overtrained runners sometimes have abnormal hormonal responses, suggesting that overtraining affects the part of the brain that controls hormones. These hormonal changes are similar to what's seen in people with conditions like anorexia or depression. While we're learning more about the complex hormonal changes, it's clear that overtraining has a major impact on the whole body. It's like the body is trying to protect itself by making it impossible to keep training when it's reached its limit. The key takeaway? We need to listen to our bodies and respect their signals to avoid pushing them too far.